Good morning, everyone, and thank you for joining our session for the Converge to Accelerate program. Our topic this morning is going to be on the area in the policy area of divining blockchain technology and other technologies in the policy area. I'd like to introduce our esteemed colleagues that we have, Rick McElroy, Paul Browne, and Robert Wood. Gentlemen, if you wouldn't mind taking the time to introduce yourself to our audience. We'll start with
Thanks,
Rick.
Joyce. Yeah, thanks for having me. Rick McElroy, Principal Cybersecurity Strategist, VMware Carbon Black. I've been doing information security for about 25 years now, and I get to travel all over the globe and work with teams on maturing their security posture. And I'm primarily focused at VMware around the healthcare sector.
Great. Paul?
Hi, my name is Paul Browne. I'm the Chief Information Officer for Henry Ford Health System. Henry Ford Health System is about a $6.5 billion a year healthcare system in the United States that's about 2/3 provider and about 1/3 insurance company. Been with Henry Ford for about 3 years. Prior to that, I served as the Chief Information Officer at Tenet Healthcare and at Trinity Health System. Thanks for joining us today.
Yeah, and my name is Robert Woods. I am the Chief Information Security Officer at the Centers for Medicare and Medicaid Services. And so my day-to-day is effectively always changing. It involves overseeing everything from policy development along the security and privacy space to data privacy issues to a myriad of cybersecurity and engineering issues. So happy to be here.
Thank you, gentlemen, and glad to have you here. So blockchain technology is being hailed as the panacea for all healthcare dilemmas, with applications ranging from bioinformatics and EMR connectivity or AI for clinical diagnostics. For example, the researchers propose that implementing a blockchain protocol may eradicate illicit prescription drug abuse and provide a platform to manage the opioid crisis. The potentials associated with blockchain technology has caused a significant trend towards developing blockchain solutions for the healthcare and medical research industries. With this spike in innovation and application, now is the time to assess governance and policies to ensure continuous cyber technology supremacy while applying cutting-edge solutions. Currently, 17 states have introduced legislation related to the use of blockchain technology or in adjacent to healthcare applications. However, these efforts are primarily focused on developing committees or requests for information about these technologies' use, not development or governance. During this period of evaluation and rapid adoption, leaders and policymakers must begin considering the need for governance and drafting policy to ensure solutions are developed to protect patient privacy and comply with best practices for security and interoperability. Let's get started, gentlemen. Please discuss your impression of the rapid development and adoption of blockchain technology in healthcare. Who do you see as the primary benefits, and what do you see as the primary concerns for this rapid adoption? We'll start with Robert.
Sure. Yeah. So I think the patient has to be the one who primarily benefits at the end of the day, right? Or the consumer of healthcare. So, I think with the many different applications of blockchain or just big data or other emerging sorts of technology problems or approaches to problems, it's very exciting for the consumer of healthcare services, because ultimately, if the delivery of these things and the administration of these things improves, then ultimately their experience, their care, their costs, all of those things that go into their overarching experience with the healthcare system improves. Now, I think like any emerging technology, we have to it's exciting. We should be rushing into, in my opinion, experiment, but not wholesale adopt things based on handshakes, winks, and nods, and a lot of big words. And so, some things that I think are quite interesting and novel about the risks of something like blockchain is that it's immutable, right? Which is in many ways considered a strength and an advantage of it. It's transparent and it's immutable. Okay, sweet. What happens if we're rushing and something is not correct on said blockchain, and that immutability property ends up resulting in downstream issues because there's things built on a blockchain that then have resulting downstream negative consequences. And that's something that I think needs to be considered in the broader context of like governance over emerging technologies such as like artificial intelligence, blockchain, et cetera, when we're talking about how these things relate to more important problems than serving up pictures of things that match somebody's interest or other more non-mission critical applications where this kind of technology is typically first applied.
Okay. Rick, what are your impressions?
Yeah, well, look, I'm always cautious to say something's a technological problem for a deeply complex issue like the opioid crisis, right? Although I do think direct impacts to consumers of healthcare, direct impacts to providers, as well as I think limiting the amount of healthcare fraud that occurs as well. I think there is some promise that blockchain technology could help to do that. I think one of the areas I think about as well is increasing complexity. Right. So if you look at standard blockchain implementations, they're fairly complex, which causes a number of different areas from a risk perspective and from a threat perspective that adversaries can take advantage of to get the data. So while I do think there is hope, I do think with a thoughtful approach to Robert's point, right, accounting for these things up front. I think to your point earlier, Joyce, about starting to look at regulations that are meaningful now. Great. Let's do that during the ideation phase, during the prototyping phase, and then start to do some limited rollouts of that technology, understand the impacts, understand some of the unintended consequences of those, and then maybe more broadly bring those use cases out to market.
Thank you very much. Paul, I know you don't have a deep background in blockchain. So what are some of the things that might concern you, or what are some question that you might have for your colleagues here about blockchain in a health system?
Thanks, Joyce. Really appreciate it. I had to chuckle when I found out the topic for this discussion was blockchain. I remember a survey of healthcare CIOs 3 to 5 years ago about blockchain, and the primary conclusion of the survey was most healthcare CIOs really didn't even know how to describe blockchain. So it's a somewhat amorphous concept, but if we simplify it to, there are many transaction points in healthcare where data is shared between entities, and blockchain creates an opportunity for us to share that in a different way, then I think the possibilities are pretty exciting. And I think of processes in particular that cross over the provider and the payer space and create administrative overhead in healthcare. For example, every healthcare system in the United States today spends an inordinate amount of time every year reconciling payments with insurance organizations. Well, if you think about the concept of a shared ledger in real time that sort of balances billings with payments and eliminating the countless hours and dollars associated with that administrative overhead, that's very exciting because every one of those dollars saved is a dollar that could be put back into patient care. So whether it's, blockchain or other forms of newer technology, I come at these things with a mindset of, can we simplify and take administrative cost out of healthcare so that we can put money back into caring for people who are suffering and in need of healthcare services? And I'm really excited to be able to spend time with Rick and Robert today as they think about how to execute on this in a very responsible way that advances the cause rather than limits its possibilities.
Great, Robert. Going on, let's build upon what Paul had just said. Would this be a possibility in the claims arena at CMS?
It's certainly, I think there's just about anything is possible. It's a matter of, I think, in many ways, making sure that you craft problem statements appropriately, such that you're not kind of going on. It's, I have this this kind of keyboard rage every time I'm sitting on Slack or email, and I hear somebody talk about the fact that we're going to solve something else with like AI. And I feel like AI is usually the term thrown around for, I want to make something maybe go faster, and I'm just going to magically use AI as though it's going to help. And so like blockchain to me very much follows the same kind of pattern. And in order for those things to work and to add value and to be a viable solution to any given problem, you have to understand very distinctly and appropriately what the problem is you're trying to solve, like what the constraints to it are, what kind of data you actually have, is it structured appropriately, do you have access to it, and then you have to have people who can actually come in and sort of build on these things. And I think that's one interesting dynamic to all of these emerging technologies really is the talent pool of people who are able to come in and execute in a particular area is very limited. And so one as a sort of product owner or somebody with a mission who's trying to solve a problem, if you like that carries, in my opinion, tremendous risk, like organizational or delivery risk, because like if you bring in somebody who's basically going to be like Googling on the fly, how do I blockchain and trying to do something like that is not going to lead you to the sort of outcome that you want. And similarly with any other emerging technology, it's you want somebody ideally who's well versed in a particular thing to come in and be able to think about the nuances, think about the edge cases, think about supporting technologies, et cetera, because otherwise you end up with like the equivalency of hiring somebody to do a big data problem, and they're coming in with like Microsoft Access on their on their laptop, and they're messing around with things, and it's you're going to end up with a half-baked solution. So I think like the short answer to your question is like yes, but with a big asterisk that anyone who wants to go down that path would need to really think through and like really think through how and why and what problem they're trying to solve.
What do you mean? I mean, we can't just go on YouTube and get a DIY?
I mean, you certainly could. I hear this all the time, and this is why I get the keyboard rage I referred to with AI. It's like, it sounds on the surface really easy. You have vendors who are constantly knocking on your door saying, we can do this thing for you. But like in that particular field and specifically, or in that domain, a lot of it boils down to like, do you have data that is structured and clean and like ready for potential modeling and like model training and development and all of that? Do you have a way of like storing it at scale? Is it labeled? Is it classified? All of that stuff. And if you don't, then if you had all of that, then the actual engineering work and the design work is probably fairly trivial and straightforward. Once you have all that stuff done, most of the hard work comes in preparing, getting yourself ready. And I think that same sort of dynamic exists in any emerging sort of technology or field, blockchain being one of them. And especially I'd say that goes even further when you consider that we haven't, like, there's really not been a lot of talk that has gone into the governance models around something like a distributed immutable ledger, i.e. blockchain, and how that is used to drive any kind of problem. There's been talk around like AI regulation and stuff like like making sure that there's not bias in models and stuff like that, like how to manage negative outcomes like that. We haven't really had many, big, deep conversations at a governance or policy level around something like blockchain yet.
Yeah, and that's one of the big challenges. Rick, what, going off of what Rob just said, particularly about having people who are well versed, if you will, in blockchain, and having the workforce to be able to do these kinds of design and implementation. What are some of the other risks and threats that present themselves rushing to implement these types of technologies?
Yeah, it's a great question, right? And I do think, thoughtful implementation matters. I think Robert and I are on the same page about a lot of stuff. I kind of feel the same way. But generally speaking, I think it's the implementation that has shown weaknesses throughout multiple blockchain implementations, right? Whether it was for financial purposes, for supply chain and contract purposes. One of the key areas that we see, attackers, or at least folks that are attempting to break the chain and or create false transactions, are really around timing-based attacks. So some of the implementation there, I think, using weak ciphers as part of the implementation, poor key management, which goes again towards having a trained staff that knows how to implement the technology, and I think more broadly, as you start to look at how this technology has been implemented, it's also written by software developers and sits on endpoints and workloads in a distributed fashion, right? And we know that chain currently today is vulnerable. And so I do think, again, having those upfront testing processes, building in misuse test cases over just the use case, the good use cases that we would see, I think are needed. And then of course, how many handfuls of people are actually trained on the planet to start to muck around in these environments and actually cause things like heat sprays and some of this? Well, the answer is not a lot. So back to Robert's question, I mean, if I'm a security professional, before I accept it, I'd like a partner or someone on my team to be able to adequately test that and have enough knowledge to do that. And I do think there'll be a lag in that as far as that goes.
And particularly, I think with the many moving parts that are involved in healthcare, as Paul, you well know. So, the proponents always tout benefits such as EMR interoperability, privacy, patient identification as easy points for implementing blockchains. What are some of the implications that you see from your role for patients or providers when implementing or using blockchain solutions?
Well, my first thought, Joyce, as you kind of comment on that is, I think the right places to start with newer technologies in healthcare is on what I call the administrative side of things. Information about the health and wellness of Robert Wood and Rick McElroy and Joyce Hunter and Paul Browne is extremely personal. And anytime we're using new technologies to handle and manage that information, we wind up with unintended consequences. And so I think diving into sort of deep clinical operations with newer technologies may be a mistake in a lot of cases. And there are more benign processes in healthcare. For example, every physician that practices in a hospital in the United States has to go through a credentialing process. That physician also needs to go through a credentialing process with every insurance company. Those processes are very similar, and they all involve accessing various data sources and confirming various information. So if we, through a distributed ledger, had a capability to sort of share the load of that credentialing process across organizations and eliminate redundancy, then we save time, money, and effort. And if we mess it up, it doesn't wreak havoc. It doesn't expose information about individuals that could be used in pernicious ways. So my thought and counsel relative to sort of where do you start is maybe some of the more benign processes that in particular cross multiple stakeholders or entities in the healthcare ecosystem where there's redundancy and overlap.
Great, thank you very much. So now, Paul, staying with you. So the existing privacy and identity legislation that are applied to new technologies or innovation, how do you think blockchain would fall into that, like HIPAA and you know, some of the other standards and things that have come out in recent years?
This one is very vexing for me. I think we live in interesting times where we have things like the 21st Century Cures Act that requires any person or entity in the ecosystem who has information about a patient to share it with others at the request of the patient. And yet we have, you know, sort of serious counter regulations that should that information ever be shared, you know, without explicit consent is a real problem, because then clinicians wind up with an incomplete picture. So I think we have a social schizophrenia going on regarding healthcare data, where I want every provider who's touching me to know everything about me that could possibly be known, unless I don't want them to know a particular bit or piece. And then I want to be able to kind of keep that out of their line of sight. So I think our existing policy frameworks actually need to mature a lot to try to reconcile the very real needs of clinicians and patients to have a full 360 view of them when they're being treated, but also to have a lot of control, much more so than they do today, about who can see different pieces of that picture. I would also comment, just to add on, that having been in health systems that have operations in 20 or 30 states, it's really very problematic today, from my perspective, that we have state level laws that also intermesh in this framework with federal laws. And it becomes very difficult to be efficient as a healthcare or technology operator in reconciling all of those different laws. I think increasingly with telehealth, you know, blockchain, big data, healthcare is becoming maybe a bit more national than local in certain ways. And I would like to see the policy frameworks evolve to be a little bit more at a national level than at a state level. Just one perspective.
Absolutely. And boy, does that open up another can of worms, Paul, right? Because then the states will say, well, you can't tell me what to do, right?
Sure, so. Of course. We have a little bit of that going on these days, don't we?
Absolutely. Anybody else want to comment on what Paul just said?
I would just say briefly to piggyback, I'm in 100% agreement with Paul. It's pretty typical. Big things happen, headlines happen, politicians start to talk about it, consumers suddenly, you know, and then we create a point in time regulation, right? And I think it's to address the specific issues that were raised at that point in time, and not necessarily a holistic look across the board. And so I have a tendency to agree with Paul. You know, I work internationally as well, and you know, that it becomes much harder when you get on a global and international scale and all of those things as well. And so, you know, to the question about privacy, well, look, I think there's a lot of blockchain advocates that would say that putting data on the chain is a bit more secure or private than what we're doing today, right? I think, and I'll stipulate that I will agree with them in theory on that, again, if it's implemented well. But that being said, you know, which state's going to go first, right? Who's the exact use case? Are they going to come up with their own legislation as someone else? And so I do think a faster iterative way to get through regulations that makes sense. And then, of course, I think having a few more members of the healthcare community at those tables as those are being built is going to be helpful.
So let's talk going down the governance chain. I know when I was the deputy CIO at the Department of Agriculture, every time you mentioned governance, people would run. I mean, so governance is not necessarily a popular word, but we know it's necessary. So let's talk about the pros and cons of overarching governance, which is what we're basically talking about. If we're going to get away from each state doing their own thing in that federated model, and we're going to have these overarching policies compared with a industry-specific governance model, such as HIPAA. What are the pros and cons of that? We'll start with you, Rick.
Yeah, well, look, one of the pros is it can easily digest one thing, right? And hopefully apply that to many things. I mean, that's the simpler it is to apply, generally speaking, the easier it is to implement. But there's cons to that as well, right? I mean, we do get into questioning, fundamentally how we're built as a nation, right? And so those things matter, right? And while we might be highlighting some of these issues specific to healthcare, I don't know that we're going to go change the system that way, right? So I think for me, thinking about overarch, I also think like standards bodies. So if you look at NIST and everyone builds their security programs, right? Generally speaking, around NIST and ISO and some other ones, there's still some things that are open for interpretation. We know that shops that are full NIST and do all the things are probably still open to get breached, right? So again, I think it's got to be realistic. I think we have to get security and privacy to the table, especially when we're talking about blockchain. I don't think you can decouple those two conversations. And I do think that they're complementary services to each other, right? Security should, in fact, protect your privacy and identities, and vice versa. And so I think, look, we know what we know now, and we know a whole lot about technology implementations, how rushed we've been in some cases. I like what Paul was referring to earlier about, making them easier to digest and understand and actually translate that into a technological solution. So I do think someone like, whether it's Health and Human Services or DHS or CISO, or, someone who puts a standard out around, blockchain or AI being developed for healthcare, like I think that'll be helpful. So that the technology manufacturers have something to adhere to and build. But yeah, that's my general thought.
And they basically almost did the same thing back in the day with HL7, right? So, you can have these standards-based policies that everybody kind of adheres to. So if you look at that, Robert, should legislation be enacted at the state or the federal level? Which would you advocate for? I think we heard, well, Paul will come down on this, and why?
I don't know if I'm the best. So, I mean, this is obviously just my opinion. I am certainly not in the policymaker scene, but I mean, I think there's a lot of benefit philosophically for legislation to be driven at the so I'm gonna play both sides of this coin. So I think you kind of get more you cast a wider net at the federal level, obviously, but I think because of that you end up you likely end up with a it's kind of like an inch wide or an inch deep, mile wide versus mile deep and an inch wide sort of approach. And so the like generalist specialist sort of dynamics. And I think if you do something at the federal level, you're likely going to end up sort of stripping out a lot of things to cover a lot more potential use cases or concerns, things like that across all state. And you're basically accommodating more voices. But it also could get the ball moving in an interesting, useful way. That being said, I think doing something at the state level is interesting because, we're talking about this because we don't actually know. This is all largely hypothetical in many ways. And so doing something at the state level, I think, does introduce a more interesting opportunity to try small and learn. And so, I mean, like most of my career background is in startups and tech companies where that's kind of the mantra. It's like, define your MVP, test small, learn fast, and kind of learn your way through problems. And I think doing something big like this on a smaller scale could be really interesting. However, that being said, if it's just done in a vacuum and nobody's talking, and then we end up with 40 of these things, then then that's also not super productive. But if it were, if there were some level of coordination amongst feds and state governments, and you're testing things out on a smaller scale where you can learn and then coordinate those with the bigger body of resources and people and legislative bodies, like that could be really interesting.
And I think that at first, that was the original premise behind the health information exchanges, right? So they put it out there, everybody kind of, each jurisdiction or organization decided that they were going to do something that was specific for their area, Indiana, California, New York, and those that were very successful, it was highly suggested by the Office of the National Coordinator that they kind of disperse that throughout the entire enterprise. So let's talk about looking at blockchain as a more standard technology. And let's talk about what everybody thinks blockchain is, which is Bitcoin. Would you recommend policymakers consider cryptocurrency examples when evaluating healthcare applications or policy needs? Rick?
I say yes. One, it was the earliest implementation of the blockchain, and I think there's various forms. I have a tendency to lean towards like financial operating system models like Cardano that are very thoughtful and take a very thoughtful approach to digital identities and transactions and contracts and all of those things. But I do think we have to learn from the first people through the breach, right? And so I think it's helpful to understand threats. It's helpful to understand risk. It's helpful to understand scale, the type of chain that you're going to run on. After all, in healthcare, seconds matter. And so picking the wrong technology that takes too long to actually, confirm a transaction among multiple hosts in a network, or you have too much latency. Yeah, those things matter. I mean, it's why a lot of the major retailers haven't exactly picked a horse yet, right? In the cryptocurrency debate. So yes, I do think it's useful. I also think there's some interesting use cases in healthcare as far as like incentivizing consumers to participate in surveys or studies or pharmacological studies, which would probably either need to be facilitated today via checks and payments to debit cards, or in the future, possibly using something like blockchain for that. And so I do think, as the world starts to look at digital identities going on the chain, which seems highly likely in a lot of countries, it's a natural thing that will probably follow for them is your identity's now on the chain. What are the other services we can attach to it in records, and it'll fall from there.
Ooh, excellent. Paul, what limitations do you see to governing blockchain in healthcare applications?
Well, there's a lot of tension between the incumbent actors in healthcare, right? Payers, providers, payviders, newer entrants into healthcare delivery. Look, at its foundation, blockchain, at least as I understand it, is, a newer, more advanced way to share information. Well, if any two actors are going to share information, there needs to be a level of trust in terms of how that information is used. And there's a lot of mistrust between the actors in healthcare today. And so that really presents an impediment in terms of bringing those actors together and saying, let's agree on some standard approaches to things. I think the other thing that is a real challenge in healthcare delivery is healthcare delivery in the United States is incredibly fragmented. Mm-hmm. For example, we have about 5,000 hospitals in the United States. The single largest hospital company in the United States operates less than 200 of those hospitals. So, the ability to agree on standard approaches to anything, is really very difficult. I would contrast that with the auto industry, not many people know it, but in 1920, there were a few hundred automobile manufacturers in the United States. Today, there are, depending on how you want to count, 3 to 5. Imagine if we had 400 or 500, 600 companies, making cars in the United States today. You'd have steering wheels on the right side, the left side, the outside. You kind of have a hot mess on your hands. So I think the fragmentation in healthcare delivery and the natural mistrust of the actors create some pretty significant impediments to moving forward, quickly with technology that at its core is binding organizations together in new ways.
Yeah, well, so one other interesting point on that is regarding the actors. So consider like big providers, big payers, is they may have, I'm gonna steal some terminology and concepts from like the SaaS B2C or B2B world. Is like, there is a concept of customer retention or people basically like wanting to keep people in your world, and there's a switching cost, and if like there may actually be misaligned incentives to adopt something that makes it easier for the consumer. And I hate to say this, but like for almost no organization, like the bottom line is a huge consideration for most organizations because it has to be. I think like I used to be that super altruistic individual, like cybersecurity person who was like, security is the most important thing, huzzah. and then like going to work for an actual security company and learning like it's not actually the most important thing. Like doing stuff for the customers and the bottom line is the most important thing. And so that was very eye-opening for me early in my career. And and I think there's like as it pertains to potential adoption of blockchain technologies, one has to consider like would the big players want to participate in such a thing? And if because they have immense power in this whole dynamic and could muddy things up, slow things down, fight it, et cetera, build their own, cause confusion. Like there's a whole bunch of ways that this could go off the rails and sideways. And because making it easier for customers to see prices transparently, to move data between providers, like those things are part of the business model. And there may not be incentives to sort of change that business model.
Great. Well, this is our last question, gentlemen. So I do want everybody to formulate an answer and provide your best recommendation. What are your key recommendations, suggestions, thoughts for policymakers evaluating the use and governance of blockchain solutions in healthcare? Paul, we'll start with you.
That's a big question, Joyce. Can I get back to you next week?
Certainly.
Yeah, I think, my counsel to policymakers and others would be to realize the incredible sensitivity associated with the health data of individuals, and to recognize that no matter how much we might try to consider every possible scenario and use case, we never can. As such, we need some regulatory and policy frameworks that allow for ongoing adjudication associated with challenges in using that data and protecting individuals from the misuse of that data. And so I'd encourage, rather than trying to create a 5,000-page piece of legislation that tries to encompass every possible use case or scenario, creating some framework for adjudicating situations where someone or some group feels that the data has been used inappropriately, and that there should be some redress for that.
Okay. Robert, what do you think?
I really like Paul's answer. I think I'm gonna say, I love everything about that answer. I would build on it only by saying we should be thinking about structures, regulatory structures, such that we can learn, we can get high value, high impact learning on the smallest scale possible. And I know like legislation and regulation does not move quickly. It is not known for being a very nimble thing. But the faster that we can learn our way through it, and something like a governance model that allows stuff to happen and just be reviewed by such an overlay, is potentially a way to create that fast learning environment, because the nature of this kind of these emerging technology approaches is that, and domains, is that it will inevitably change. Like change is the only thing that death, taxes, and change is like you can expect on those, or you can count on those. And so so we have to make sure that any kind of like regulatory output that comes to bear is a lot, like allows for that kind of like fast, flexible sort of experimentation. Because I think without it, it's just going to fall completely flat.
Rick, what do you think?
Yeah, I love Robert. I love Paul's idea. We need to iterate regulations and standards as if they are code, because that's how fast we're moving in technology. And so hopefully at some point in the future, our regulators and legislative bodies catch up to that, right? Secondarily, I do want to reiterate what Paul said. Consumers need a much larger voice in this equation. Oftentimes, we're not even being consulted about the technologies being used, how it's being used, who owns my data, can I get it out of the blockchain, how do I do those things? That's got to be accounted for. And then lastly, the one piece of advice I would give to anybody that's participating in this, right, is minimal but sufficient, right? We need the exact right data set that's needed for the use cases, not anything more, not anything less. And we have a tendency in information technology and in systems to collect all the things and then figure out what to do with it later. And so I think healthcare represents a perfect, vertical to go after this minimal but sufficient, like just the data that you need, doctor, to please make a decision on my health. And I'd like to facilitate that as a consumer, all of those things. But at some point, I may leave, exit to another provider. I may move states. That's happening a lot right now, right during the pandemic. And so again, I think thinking about consumers and modern consumers' demands for privacy and security should be accounted.
Great. Well, gentlemen, thank you so very much, Rick McElroy, Robert Wood, and Paul Browne. We appreciate your participation in this session of Converge to Accelerate. And my name is Joyce Hunter. I am the Executive Director of the Institute for Critical Information Technology and a co-ambassador for the District, Maryland, and Virginia chapter of Blockchain in Healthcare Today. Thank you and enjoy the rest of the conference.